Hello ladies and gentlemen, and welcome to today's video podcast from Vetstoria. My name is Morkel Pinar, and today I'm going to be talking about fly strike in rabbits. Anyone who's ever seen a rabbit affected by fly strike will hope never to see this condition again. Yet, in summertime, many vets see at least one or two of these every week. For that reason, we are dedicating 2 podcasts to this dreadful condition. In this first one, we're going to explain what fly strike is and what can be done about it. Fly strike occurs when flies lay their eggs on another animal. The eggs hatch into maggots, which then eat away at the animal's flesh. In warm conditions, the whole process from eggs being laid to maggots emerging can take just a few hours. The consequences can be devastating, and in the worst cases, there will be severe tissue loss where the rabbit is literally eaten alive by maggots. If your rabbit happens to be affected by fly strike, it's an emergency, and regardless of what time of the day or night it is, you need to seek veterinary attention straight away. This is our patient, apparently looking comfortable, until you take a look at his back end. You can appreciate that the skin is sore and moist, but we cannot see any maggots straight away. You need to take a better look. Then the parasites suddenly appear in great numbers, crawling in the fur and eating the flesh away. This illustrates how careful you have to be when checking your rabbit for fly strike. This is a close-up of a maggot, just in case you didn't know what these little horrors look like. On this occasion, the owner spotted the maggots early enough and the treatment could be started before any irreversible damage was done. The first thing to do is to clip away the fur before dunking the affected area in lukewarm water to remove external maggots and any dead tissue. This usually requires a sedative, but on this occasion, our patient was both very sick and very docile, and it did not resist the treatment. It is important to carefully check for any maggots concealed in the flesh of the rabbit. When satisfied with the decontamination of the site, the veterinarian will administer antibiotics and painkillers to treat the inevitable infection. More aggressive treatment may be necessary if the patient is in shock. Here's our friend already looking much more comfortable. And you can appreciate that this skin looks a lot better the very next morning. While the rabbit that we saw in this presentation was saved and recovered very well, we see many sad cases where large amounts of tissue has been eaten away. These are sometimes best put to sleep immediately to prevent further suffering. Therefore, it's very important to try our best to prevent this potentially fatal condition. I encourage you to watch our next podcast, which will be dealing with this aspect of the disease. Well, that concludes today's video podcast. Thank you for listening, and remember to check out vetstoria.com for further video podcasts, and please feel free to leave any comments or suggestions for future topics. Goodbye.